Hi everyone, thanks for joining. We'll get started in a few minutes. I think we want to thank Steve Rimar for joining us and presenting this session. This is the first time we're doing an online webinar, so there may be a few hiccups. Please let us know in the chat session if you are finding any challenges or issues. We also have a Q&A tab, so if you have any questions to ask Steve during in the webinar presentation, please make sure to use the Q&A tab. Steve will get to it as he goes through his presentation and respond. Steve will be joined by Brent as well, and Steve and Brent will go through and answer questions as they see them as they come through. With that, I just want to mention, DataCon LA is going virtual this year. So we'll be sending out registration information in about a week's time. Please feel free to take a look and sign up for that. Other than that, we're going to have these webinars continuously. So we have our next one on June 25th with Gene Home, who's the Chief Data Officer for the City of LA. Hope you guys can join us for that as well. With that, hand it over to Steve and let Steve take it from here. Thank you, Steve, once again.
Thanks, Subhash. Can everybody hear me okay?
I guess you won't get a response. You just probably chat.
If you can hear me, I'm assuming they can hear me.
Yeah.
Okay. Do we want to give folks a couple more minutes? Or do you want to get started now?
I guess you could wait a few more minutes. It's only 6 people now so far, so we can give them a few more minutes.
Sure. Looks like a lot of folks are logging on now, so we'll give it another minute or two.
Yeah, makes sense.
Everybody's gonna enjoy their dinner.
Yeah. Let's give it a couple of more minutes and then get started.
Yeah, there's a lot of people coming on right now, like one
Yeah.
every couple seconds.
Yep. I guess you can start, Steve. I think we got pretty good attendance. I mean,
Sounds good. Okay, good afternoon slash evening, everybody. My name is Steve Rimar. I'm the CEO and founder of Analytica Consulting. As Subhash mentioned earlier, today I'm going to be presenting to you how we worked with the governor's office on providing and helping their response with dealing with the COVID-19 pandemic using our data analytics skills. I'm going to be joined by Brent Johnson. He's one of our principal consultants. He's out of the Sacramento office, and he's going to be available for any additional questions and support and sort of helping move this along. We've got a good number of participants, so we're going to go ahead and begin. I hope that you all can hear me clearly and see me. If you have any questions, like Subhash said earlier, there is a Q&A button that you're going to see on your screen. You click that and then ask your question in the Q&A section. We're going to try to monitor the chat, but we prefer if you would use the Q&A button on your screen to ask your question. And feel free to ask the question throughout the presentation. There will be time at the end, but we want to make this interactive, so feel free to ask your question, and I'll try to monitor that part of the Zoom to answer your question real time. So let's go ahead and get started. So the agenda for today's talk is I'm going to give you an introduction about me and my firm, and then we're going to jump into a timeline of how we even got involved with working with the state of California and the governor's office. And then we'll talk about how there was a dashboard task force that was actually formed by the governor's office and how we became part of that, and the results of what we developed as part of that task force. And then the majority of the presentation is I'm going to walk you through a lot of the challenges that we had to overcome with working with the various data sets, developing the visualizations, doing all the data engineering in order to get the data efficiently and effectively out to the government agencies and to the governor himself on a daily basis. And then, as I mentioned, I'll leave time at the end for Q&A, but feel free to ask any questions throughout the presentation and I'll get to them real time. So my background, I'm the CEO and founder of Analytica. Prior to working and founding my company, I was the director of analytics at Qualcomm. I actually spoke at last year's DataCon LA. It's an excellent event, and if you haven't attended in the past, I highly recommend that you attend. I know that this year will be virtual, but the content will be just as good, if not better, as last year. So prior to founding my firm, I managed all of the analytics globally for Qualcomm. Qualcomm is a large semiconductor wireless technology company based down here in San Diego, where I'm located. I managed a lot of their analytics throughout the organization, saw a lot of use cases. I basically ran a consulting firm within Qualcomm, working with a lot of their different business units, providing analytic solutions and machine learning and data engineering and visualization. Prior to that, I was a principal consultant at Accenture. I was out of the New York and New Jersey office, and then later in my career, I was actually out of the LA office and worked within the media and high tech industry, providing very similar analytic solutions. And all in all, I have about 15 years of analytics and business intelligence experience, with about 20 years of experience specifically within IT and software development and enterprise architecture. There's a lot of publications that I have out there. I'm not going to go through all of them, but feel free to peruse the net and Google me if you will. And with that, I'll introduce our firm. So Analytica was founded by me down here in San Diego. We started with working with a lot of the large organizations down here within this vicinity, with a focus on working within the biotech and healthcare space. So our firm essentially provides everything that our clients can't do internally. So anything from analytics solutions to visualization solutions and dashboards, analytics strategy and roadmap, data engineering and data architecture, machine learning, statistical modeling, anything around working with data to either improve patient outcomes, improve product development, improve manufacturing processes, anything that our clients can use our skill set for in order to help their businesses and their organizations run smoother. So our office in San Diego works primarily within the biotech and healthcare market, like I said. We also have an office in Sacramento, the office that Brent is out of, and that deals with primarily working with the state of California. I'm going to show you essentially a timeline of how we got started. And it kind of will paint the picture of the rest of the presentation. So as a firm that specializes in analytics, you don't see a lot of companies like us working with the government, especially the state government. Analytics within the state agencies definitely lags behind the commercial sector. And one of the things that we were bringing to the table was we were taking our experience and our expertise from working within the private sector, and we really wanted to work with the government sector to sort of help catch them up. So we started working with the California Department of Public Health back in 2016. And the department back then, they were in need of essentially having a firm come in and take their analytics to the next level. So the Department of Public Health has a lot of missions and goals in terms of how they run that agency. One of the biggest missions is to essentially improve healthcare quality throughout the state of California. And with that, there's a lot of epidemiologists that work within the department. There's a lot of research scientists, analysts, data scientists. And where we were coming in was essentially the department needed a platform to be set up so that all of these different individuals can sort of develop all of their solutions on one platform. And we also were providing quite a bit of code development and training on the platforms that we were standing up and helping them sort of get to that next level of everyone sharing their data, sharing their dashboards, sharing their research, sharing their analytics. And that was one of our first projects back in 2016. And we've been working with them ever since. Now, when the pandemic started, we were in a very unique position to help the state of California because of our many years of experience in working with the Department of Public Health. And like any major public health event, like a pandemic, that's the main department that's going to step up and do a lot of the, the support for the state, do a lot of the analysis of the data, figure out how to route the funding, how to support the governor and his staff. So we were in a very unique position when this began. And back in February, we noticed that, with all of the data that was coming out so early with what was happening all over the world, that it was inevitable that this was going to reach the United States, especially going to reach California with our size and our population and our diversity and the travel hubs that exist in LA and San Francisco. So we started having conversations with a lot of the leadership with the Department of Public Health and trying to figure out how do we use our existing contracts, our existing funding to sort of help spearhead a lot of these efforts. And it's a very complicated thing. When the pandemic started, it's not like, the government caught on, set aside billions of dollars and said, this is what we're going to use to fight this thing. Nobody knew how bad this was going to get. And this really caught our government and the world by surprise. So even though that this was happening and we were in a unique position and we were working with this department, we couldn't just step in and start helping them work with their analytics and getting a lot of this information together so that the government can craft a response and use the data effectively. A lot of work needed to be done to do that. So what we decided to do was we wanted to just publish our own COVID-19 dashboard because we have a lot of domain expertise in public health. We understand how to work with this information really well. So we sort of went out on our own, and around March 1st, we published our first COVID-19 dashboard that showed the situation in the US. And we used a lot of the data from Hopkins and the CDC and WHO and what was happening in China. And we started reaching out to the media outlets, and we were published in the San Diego Union Tribune. Once that occurred, it's interesting, when we published that and we were getting a lot of views, it sort of helped escalate our ability to work within the state system and unlock a lot of funding so that we could essentially work with the state and use our skill set to get the same type of data that we were putting together for the public, but to the next level, focused on California, looking at more internal information. And after we published our dashboard, that's exactly what happened. When we went back to the table to talk to the leadership of CDPH and some of these other agencies that we work with, they sort of came together and they released a sizable amount of funding to fund us and our staff and our team. And that's when we officially joined the governor's dashboard task force. The dashboard task force was already going. It was funded sort of internally. There's a department within the state called the Department of Technology, the California Department of Technology, and they were doing a really good job with the resources they had to get the data out to the governor, to collect it from all the agencies. And I think with the addition of us at the end of March, it really escalated their ability to get this information out there and to arm the government with the right information so they can formulate their response and respond to this adequately. And we got our first dashboard released very quickly, within days. It was a public dashboard. I'll show you screenshots of it. And its goal was to essentially, get the information out there so that the public can look at it. And it was getting, lots of views, much more than what our dashboard was getting in the Union Tribune. This dashboard was published all over the place in Tableau.com and many media outlets. So we were getting 30,000 plus views per day. And at the same time, once we released that public dashboard that was very focused on California, we then started working on a lot of the internal dashboards that the actual government of California would use in order to deal with this response. And we released the first set of those internal dashboards around mid-April. So as you can see, there was a very long lag time between that first community transmission and when we were finally able to get involved the right way, get the funding approved, and sort of help build the business case of why a firm like ours can sort of help be the catalyst to get this out there. And once we were there, as you can see by the timeline, things moved very quickly. So I'm going to tell you some of the trials and tribulations that we went through. So first, I want to show you what we released on our, using our own internal development. This on the right-hand side, and I'll show you a more detailed version. But the goal of this initial dashboard was twofold. Number one, we wanted to, as an analytics firm, we just felt like it was our duty to use our public health knowledge and our ability to, understand this information and aggregate it very quickly to help inform the public. We saw the writing on the wall. We knew where this was going, and we really wanted to do our part to get the information out there. And that's why we were able to get published. in the Union Tribune. It was a very internal effort. This was done very early on. We started the development in this actually in late January, and we finished it in March. And it took a really long time to build because there was just so much data out there, and it wasn't really centralized. One of the first places to centralize it was Johns Hopkins. And even the Johns Hopkins data had a lot of delays in it. There wasn't really a strong API because this was just happening so quickly. And I know that there was a lot of data sets. You know, there was an individual, a young high school student that built a website that was aggregating data off of a lot of the media information. So we looked at that, using that possibly. But all in all, we settled on the Hopkins data set. And then we also referenced a lot of the studies that were being released to visualize them. So let me show you what that looks like. So we were on the Union Tribune's homepage for a long time. And off the homepage, this is essentially what you were able to go to. And this dashboard basically, it has a very clean user feel. We wanted to use very simple aesthetics. We wanted to use a very neutral color scheme, especially when representing mortality. And we wanted to get the information clearly out there in a very summarized way that sort of hits home. So right off the top, we had a very simple counter. And again, all over the web, you're going to see this type of design. But again, we were one of the first ones to do this. So very simple counter showing you confirmed cases, total deaths, total recovered. And then we had this waffle map that sort of, you know, put our stamp and our style out there, showing, you know, the visual of what was happening in the States. When this first got released, the color coding was not like this. It was a little more grayer, but then we started seeing New York turn orange very quickly, followed by some of the other states. And this is actually a live view of what it looks like today. And this visual element gives you a very interesting viewpoint because, you know, states are all different sizes. And sometimes when the color coding of the state comes in, you sort of miss a lot of the smaller states like Massachusetts and Rhode Island. And with this type of view, there, you know, everyone's almost on an even scale. And I think that's a much easier way to look at things. So this was out there. We had some more detailed hover, but we sort of removed it because we wanted to embed in the Union Tribune's website. So we wanted to make the hovers a little bit simpler. The confirmed cases timeline looked a little different back then, but we sort of been updating this down to the day. And then here's some of the data that sort of I feel got us on the map, and we were showing results of studies. So this is a CDC study that sort of came out analyzing the results of hospitalizations and outcomes. So you can see here, 53% of those that are tested positive, and remember, this is all based on positive tests, not people that have COVID. Nobody knows how many people have had contracted the disease. We only know who we tested. So of those tested, and the ones that are going to be tested are going to be, you know, pretty serious cases. So these are very misleading numbers, and you have to take them with a grain of salt. However, they are alarming. And earlier on, they were much more alarming than they are now. So half of the cases were not hospitalized, the other half were. And then obviously 10% went to intensive care. And then we had a fatality rate of a range. And it's very important to look at fatality when it comes to pandemic as a range, because there's so many different fatality rate types. And what we're referencing is something called case fatality. And what case fatality represents is a positive case that's confirmed positive and a death that occurred from that positive case. Now, if you went and somehow tested 100% of the US population, I can tell you that the rate that you're going to see from that in terms of fatalities is going to be much lower than this range. However, it's still alarming to look at something like that. And that's something that we wanted to make sure that we visualize appropriately. So we went for a range for that one. And then we had other stats like hospitalizations and ICUs by age range, case fatality by age group, case fatality where pre-existing conditions occur, and then comparison with the seasonal flu. And then we're referencing Fauci's study here when we're looking at infectiousness. So this is what sort of got us on the map and really escalated our ability to, you know, use our connections, use our relationship, use our contract vehicles to become part of the governor's dashboard task force. So once we were part of the dashboard task force, it really had two main missions or goals. Integrate the data from several California state agencies. Now, when you're trying to measure the effect of a pandemic, you have to imagine that, this is something that's done on so many different levels. It's very, very complicated to aggregate all of this information. There isn't any magical database that all of the hospitals upload their information to, and there's no magical Tableau or Power BI dashboard that sucks data in and shows it to you real time. That just does not exist. So this effort requires agencies, but the agencies themselves had a tremendous effort in getting all of the data from, the district offices, and then down to the counties, and then down to the cities, and down to the facilities. And it's a monumental effort. So that was one of the biggest goals, was to get this data integrated, flowing, and somehow get it out there all the time. That's the second goal, because the whole purpose of this is to arm our leaders real-time information so that they know how to make decisions, right? How are you going to treat deficit in ventilators when you don't know where to send those ventilators, right? So the dashboards that we developed essentially helped visualize that. So, looking at ICU admissions is incredibly important, because you want to make sure that your ICU beds aren't overflowing. And if there's the ability to shift patients and move them to different ICU units, we had the data to show that. Same thing goes with ventilator availability. I know that that was a big thing that we all saw about in the news, and how ventilators were in high demand. And that was a very important thing to the governor and his staff, was making sure that the ventilators were available where they were needed. And if not, let's shift the supply to where the demand is. Same thing goes for PPE. And then the same thing goes for hospital bed utilization, and then looking at also alternate facility availability. One of the things that we helped look at was the ability to, if the hospitals were all overrun, where can we make makeshift hospitals? And the data was essentially showing where that can occur, how, when they should start making that investment and getting set up. All of this was something that I feel strongly, significantly improved how California handled the outbreak. And I feel that data is one of the things that, arms our government and arms our leaders in making very, realistic and informed decisions so that they can govern appropriately. And we see this in the business world, right? In the private sector, C-level executives have their dashboards that show them revenue down to the previous day and the operations of their highest paid business unit. And there's no reason why the government can't focus like this, can't function like this, especially in a pandemic. So I'm going to show you some screenshots of the public version. I unfortunately cannot share anything that we built internally, but I will talk about what we built and the challenges of how we had to get there. But this is a public version. This is actually something that you can navigate to. It's available on Tableau.com. If you go to Tableau.com and click on COVID-19 in the government data track, every now and then, they rotate who the featured viz is. So we were featured for the longest time, and they've been rotating ever since. And you can see here, New York was doing the same thing, which is excellent. But we're right there. This is the dashboard that we built with our partners. And this is kind of what it looks like live. So for this particular design, we went with a very clean white slate, no axis approach, because we wanted to make sure that this was something not only that was visible and clean to the public, but this is actually something that gets printed out, and the governor gets this printout of some of these things. And the messier you make it, the harder it is to look at when it's printed out. And that's kind of why we went with this design. But if you look at it, it's two main tabs. There's the COVID-19 public tab, which once it's loading here, and it basically shows you a lot of the statewide statistics. If you guys are looking for statewide statistics, and I know a lot of the media outlets kind of have their own visuals, I would bookmark this. This is probably going to be the most accurate, because they're either pulling their numbers from us, or they're using other sources, but I would say this is probably something that I would trust. So anyway, so you could see a sort on the positive cases by county, and then you can do that by deaths, new cases, or new deaths. And then positive cases, this is the total number so far with the daily change since yesterday. And then we sort of graph that daily change. The same thing happens for the deaths. And then we're also reporting the lab test results. and then the demographics from a very basic level. And then this tab sort of shows you what's happening in the hospitals. So public is in the community, hospitals just on the folks that are hospitalized. So this is showing you the patients per county, the positive COVID patients, the ones that are suspected. That's a very interesting thing to look at. ICU positive and ICU suspected. Now you really want to make sure you monitor individuals going to the ICU, because as you've heard in the news, ICU beds are limited and you can't overrun your ICU because there's only so much a hospital can afford in terms of the number of ICU patients that they have. So that's a very important stat to look at. And then down here you can see, these are the number of reporting facilities. So we're reporting about 99%. There's always a few that, just we aren't getting the data from them. It's typically facilities that are either suspended or maybe a community hospital that just can't get their information out in time. And then a nice map on the right that sort of gives you a whole visual. So this is the public version. It's really not showing you anything that you probably don't have access to already. But I can tell you that there's an internal version that shows you a lot more. I would love to share it with you, but unfortunately it has too much private information for me to do that. But what I can do is sort of talk about it. So I can pause right now if there's any questions so far. And remember, if there's any questions, please use the Q&A button on your Zoom. Okay. All right, no questions so far. So you guys are all hopefully listening intently while you're eating your dinners. So let me walk you through the challenges. And I think this is probably gonna be the most interesting part. So as you can imagine, our government is set up in such a way so that it functions, and it's a very representative setup. And by representative setup, I mean that there's lots of divisions and agencies that sort of have their focus. And that creates a really great solution when you need particular things solved. So for example, there's a department called the California Department of Public Health. And every day, day in and day out, they are making sure that California is healthy, that the healthcare quality is up to normal standards, facilities are licensed and audited appropriately. There's the EDD that's making sure that unemployment payments are going out and individuals are getting compensated appropriately. There's a Department of Social Services, Department of General Services, California Department of Emergency Services, the Sheriff's Office. They all have their own focuses. Now, when you have something like a pandemic occur, all of a sudden, all of these departments now have to function in unison, and they have to integrate. And they have to integrate in such a way that they've never done it before, right? And I think that's why, in the world, you see, there's a lot of information out there that says the United States response is the worst. We have the highest confirmed deaths and cases. It never really surprised me when I see something like that, because the United States is set up in a very siloed way. And that's done because it's representation by the people, right? We have our states segregated, we have our counties segregated. And there, with a setup like that, when a pandemic comes along, in order for us to have a perfect response, all of these counties, cities, states, the federal government, the local governments, they all would have to be working and integrated beautifully for us to have one response and be in unison. And unfortunately, that just does not exist. And California is an example of that, because we're the fifth largest democracy, or not the fifth largest economy in the world, largest state by population. So to get all these agencies to integrate was a monumental effort. And we worked with 6 agencies. So I'm going to walk through each and every one of those and the data that we were getting from all of them, and sort of talk about why that was so hard and how we were able to do that, both with technology and with process. I'm going to pause because I see there's a couple questions. One of them I'm going to ignore. I think it's like a spammer. What are your thoughts on the Apple Google app? Will it survive or die in the vine? I'm going to ignore that. a real question from Krishna is, how did you design your dimensions and metrics so fast? Did you use any special techniques? So I'm going to go back to our design here. So we have a lot of domain expertise when it comes to looking at public health data. So, we sort of knew what to show in terms of the dimensions. And, we have a lot of visual expertise in our team. Brent, who's in our staff, he's one of the best Tableau developers out there. So I think that experience sort of allowed us to iterate and move very quickly on figuring out the right dimensions and metrics to utilize in order to visualize this information as fast as possible.
Yeah, and I can add to that, Steve. So I don't think there's necessarily anything too crazy from a visual standpoint out there. As Steve mentioned, we wanted to go with kind of a clean aesthetic. So it's just kind of a combination of bar charts, spark lines, the map with locations, and then just some basic math around the day-to-day differences and percentages. So I think when it comes together, it kind of looks nice as a dashboard, but the individual elements themselves are all just pretty standard visual charts.
Hey, Steve, I think there's the question the one you were talking about, the Apple Google app. Just want to let you know, I think it's the contact tracing one that Apple and Google are releasing. So I think the question is about, is contact tracing or how will that survive? I don't know if that's relevant, but I think that is what the attendee was asking.
Got it. Okay. Sorry about that. I saw that it was anonymous. I thought it was somebody coming in. So yeah, I have heard about those contact tracing apps. That really doesn't hit our domain that much. Brent, have you heard anything about that getting utilized with CDT or the governor's office?
There's actually a second work stream that's different from this effort that's being worked on surrounding cell phone data and mobility. So I think that's where some of that contact tracing work is being done. And that's, again, on a county level, just to see how much movement there is among people since March. Specific to contact tracing, there's also a broader effort among the state government where a lot of state employees have been repurposed as contact tracers. Yep. And the way that sort of fits in is in order for some of the reopening thresholds to be hit, there's a certain number of contact tracers. That's a combination of volunteers and state employees that need to be working on that. So that's all sort of being actively worked on. I don't quite know the Apple Google angle, other than that data is being provided to feed into how they're viewing mobility among California citizens.
Yeah, I think that's going to provide like an overall high level view. I don't think that necessarily replaces, anything like some of the measures that the government's putting in place, like social distancing and wearing masks and things of that effort. I think that's going to definitely be a nice to have. We weren't really too privy to that. We were very focused on getting the data out there real time so that our government can sort of make these decisions and put policies in place effectively based on what's happening out there in the community and the hospitals. So the next question I got was from Navina. The reason to integrate with these 6 agencies is for data alone or for any other reasons? So I'm going to answer that question with this slide. So as I mentioned earlier, we had to work with many different state agencies in order to get a lot of this data. And this matrix basically shows you where we sourced a lot of this information and the domain from each agency. So you can see that the CDPH Science office was providing us the cases and the demographics and the testing data. I'm going to skip the sheriff's office for now, but the other CDPH department that we work with quite a bit is CHCQ, which is the healthcare quality department. And basically they were providing a lot of the information from the hospitals, the skilled nursing facilities, ventilator usage, and then any bed surge information. So basically what's happening in the hospitals. And then the sheriff's office, we were using that for deaths because you want to capture not only where the deaths are occurring in the hospitals, but in the community as well. From Cal OES, which stands for the California Office of Emergency Services, we were getting logistical information and then ventilator status. So they were managing the available ventilators and where they're located, and the hospitals were providing the usage. So we combined those data sets to kind of show the supply demand. From the Department of Social Services, DSS, we were looking at the homeless impact. The reason why we were looking at homeless people is, as you know, that's a very strong concern. There are a lot of homeless people, specifically, especially in California, and these individuals don't have the luxury to go and buy masks and social distance and do all those things. So we wanted to look at the homeless impact and how that's going to impact the community, as well as the nursing facility or the retirement facilities. That's what the RCFE stand for. And then we were aggregating a lot of this for the public as well. We were looking at, the cases, the county variants, the county profiles, things of that nature. So whenever you're doing a project like this, it's very complicated because you're dealing with a lot of individuals, and we had a lot of stakeholders. So each one of these departments in and of themselves is a project. And each one of these line items in these departments it's also its own project. So, at any given time, we were working on like 12 to 15 projects, and you had 3 to 5 data owners per area or per agency that we had to work with. And then on top of that, there's the California Department of Technology. That's the main technology entity that sort of reports to the governor's office. And we were working with them because they were part of the dashboard task force along with us. There's about 20 individuals there, leaders, developers. And then you've got, once you're working with the agencies, you're working with the developers, everything's flowing, technology's there, data's coming in. Then you've got the stakeholders that you're getting, this is presented to, and you're getting their feedback and so on and so forth. So that includes the leadership of every single agency, the governor's office, the chief of staff of the governor himself, the Secretary of Health of California, you name it. So, there was 100+ individuals that were involved here and 100+ people that we had to listen to in order to get this information out. And we also had to partner with other consulting firms and other developers from the government. So this was a monumental effort. And I think it really shows how, when a lot of this segmentation exists, how quickly with the right use case, people can come together and work across agencies, across organizations, across domains in order to put something out there and work together for the common good. And I felt like this is one of the things that I'm very proud of, and something that I sort of look forward to. It kind of helps me talk about this positively to my son one day, to tell him, yes, this pandemic was a terrible thing, but there are instances of where we sort of came together as a society, both on a business and personal level, to deal with this so that we could help the greater good and sort of solidify our future. So I felt like this was a great example of that. I'm going to keep going. A lot of these questions I'm going to save for the end because they're not related to the exact slide that I'm working on. So I'm going to keep going. There was a question on the Hopkins data. I'll answer that at the end as well. So, but keep the questions coming if I'm talking about something in this current slide. So let's talk about a challenge that we overcame in terms of technology. So when we first started working with the California Department of Technology, and then we got sort of inaugurated to be part of the dashboard task force, there was already a lot of technology in place to get this information out there. They were using something a little bit different than what you see right now. And the challenges that they were facing with the tools that they were using is that the iteration and development weren't as fast. The data wasn't as centralized. The visual aesthetics weren't as clean. So one of the things that we sort of came to the table with was our skill set, specifically in Tableau, and then also our skill set with data engineering and architecture, and on the Snowflake side. So when we worked with the Department of Technology, they were already going down the path of using Snowflake and of thinking about Tableau. And I felt like that was a really good decision. Snowflake, as you know, is a cloud data warehouse technology. Allows you to develop models and do, pipe data through very quickly. It's, it's very elastic in terms of how it can grow with your data set. The fact that it's in the cloud allows us to be very agile. And the fact that we're dealing with so many different data sets, we just needed a very clean place to just dump all this information into. So Snowflake just felt like a very logical first step. And, once that information was flowing into Snowflake, then that's when we kind of used our armor to build out a lot of these dashboards. And as you saw earlier, we're providing a lot of different domains, and we're combining data for a lot of different audiences from a lot of different agencies. So it's very important to make sure that, you've got clean data flowing through, that it's centralized, and that your visualization basically sits on top of that. Because the worst thing in the world is that you're going to put a dashboard out that shows deaths, for example, and it's inaccurate, or ventilator supply is inaccurate. So, I know that this is showing the technology side, but please don't discount the number of people that were involved in checking and making sure that that information was accurate. And it was happening at every level. So it's happening at the data steward level before the data comes, into the agency and works with us. It happens when it gets ingested into Snowflake. It happens when we visualize it in Tableau. It gets reviewed with the Secretary of Health and the Chief of Staff of the Governor's Office. So, there's a lot of reviews at every level. And that has to happen with something like this, because this information is so critical. People's lives are basically at stake here. So you want to make sure that you have those checks and balances in place. And the other challenge after, once we had a really good technology footprint, this sort of shows you where, the other challenge that we really had was, well, how do we get this updated every day, right? Because it's all very, very manual. I know that, there's a lot of automation you can do with Snowflake. There is a lot of database access that we probably could have used, but we're under very, very tight deadlines, and this information needed to get out there as fast as possible. So we sort of came up with this schedule, and we've actually been doing it ever since. It's lightened up a little bit, but every morning we did essentially a feature review where we looked at, what are we going to add to the dashboards? What were some of the requests that came in from the governor and his team and from some of the agencies that are looking at this? We did that in the morning, and then we planned our development, and then we had a release cycle every single evening from about 4 p.m. to midnight, and a refresh cycle that was on top of that. And the whole purpose of that was so that every day when the governor had his press conference around 11, we had data that was available to him and his staff every single day. And once the information, was sort of flowing and we were able to reduce the features or reduce the throughput of the features that were coming in, then we went back and started doing some automation as much as we could. And that's kind of where we're at today, is looking at, well, how do we, this is a very manual effort. How do we get this flowing? Because this virus is not going away. As you saw today, everyone's getting prepared for the second wave. The stock market's finally realizing that this is most likely going to happen. So this information needs to be consistently kept real time, because we need to know how to deal with the openings and the surges and so on and so forth. So, we're kind of switching from the paradigm to very fast feature release to how do we automate and refresh so that we can, make this less of a manual effort and shift our skill set to more, more advanced capabilities, such as predictions and some statistical modeling that we're doing for some of the agencies. So that's kind of where we're at right now. There was a question, let me see here. There was a question on one of the previous slides was about how was Tableau chosen? Did you consider using Looker? So within the government, the government likes to use a certain pattern of technologies, and that's done for many reasons. There's a lot of cost reasons. There's a lot of domain expertise that they're building across the agencies. So the state of California tends to prefer Tableau. There wasn't really a point where an evaluation was done. There was no time to do an evaluation. It was basically, what are the other agencies using? Let's jump on that. Let's do Tableau. And, that's not much different than what's happening in the private sector. If you have a business unit that's using Tableau over here, another business unit using Tableau over here, IT steps in, makes Tableau an enterprise solution. So in a lot of these tools, once you get to the visual aspect, they're all very, very close. Tableau, Power BI, Looker, Qlik. I mean, they all have their sweet spots, but at the end of the day, with the right skill set, you could pretty much get to any, you can develop a very similar dashboard in all of these technologies. Tableau is considered a leader, so I think that they definitely made the good decision, and because they're using a technology that's already well utilized throughout the state, I think that it's going to make it a lot easier when we go to that next step of how do we make this more automatic, and how do we push down some of the updates to the agencies themselves, so we don't need this central body anymore doing all this manual updating. So that's basically why we arrived at a Tableau. I don't see any other questions about anything else. I'm going to save some of these for last in the interest of time, so I'm going to keep going. So one of the other challenges, so I talked a lot about the dashboard side of this. I highlighted a little bit on the data engineering side and the monumental effort of getting a lot of the agencies to cooperate and agree to a structure and a format and an upload of the data. But one thing I don't want to be overlooked is the data set that we've used, that we've sort of built in conjunction with our partners, is a very valuable data set. It's actually published on something called California Open Data, and it's used for a lot of research and science purposes. So, the CDC uses this data, the WHO uses this data, and we publish it out there so that you can download and use it yourself. So if there's any data scientists or analysts on the phone and you're looking for a really good data set that's representational, I would definitely go here. I have the link provided. And it's basically the exact, it's a dump of our data set into, Excel, into CSVs, so that the community can use it for any type of purpose, for essentially the common good.
And Steve, aside from just the academics and the research side of it, another piece of why there was so much urgency around getting this information out there was for the media requests that were coming through. So I know the state received a lot of attention early on for releasing this information. So the open data portal was a big part of that as well, to respond to press requests.
Excellent. So I'm going to do a quick time check. We have 12 minutes left, and I've got to definitely stop at 7 because I have to put my kids to bed. But I want to provide a quick summary, and then I've got 2 questions that folks asked about 15 minutes ago that I'm going to save towards the end. And then if you have any questions, now is the time to start typing them in, because that takes a little time. So please start typing your questions in now, and then when I'm done with the summary, I'll answer them one by one. So in summary, as you saw, this was a very tremendous effort, but I want to highlight that we're not done yet, right? The thing that I want to talk about is what's next, right? So the biggest thing that we're working on next is, now that we have these dashboards out there, both internal and external, the next thing is to really figure out how do we keep this maintained and flowing real-time automatically. Because as we've seen, this pandemic is not going anywhere. This is going to be looked at and monitored for years. And that's something that we're working on next. And it's a really difficult problem to solve, because now we have to go down and push back on these agencies that have been giving us this data and throwing it over the fence and saying, can you guys now take this on and update your portion? And that requires them having the skill set, not only to work with Tableau, but to understand how to manipulate and upload and all that complexity that goes into it. So we're actually starting that effort next week. It's probably going to take us months to get there, but it has to be done, because we need to, the centralization of this needs to get dispersed, because we need to make this a little bit more efficient. The folks that are publishing this data are the ones that really should be putting it out there real time. It shouldn't have to go through this other authority. And it's going to streamline things quite a bit so that we can put individuals into other areas. And one of the areas that I mentioned that we're starting to get involved in is looking at a lot of predictions. So we've been working with the California Office of Emergency Services and doing a lot of statistical modeling for them, predicting PPE supply, predicting ventilator supply and demand, using machine learning algorithms to figure that out. That is really the next best use of our skill set. And that's what we're going to be working on is to sort of, move this effort to something that can be more automatic. So I've got 3 questions to answer, and please keep them coming because we've got this open for another 10 minutes. So there's a question from Navina that I think we answered, the reason to integrate with the 6 agencies. I think I answered that, Navina. If not, let me know. So the next question from an anonymous attendee is, are you working on any prediction models based on the US and international data? If yes, any ideas if we'll see another wave in fall/winter or more of a W versus a V? This is gonna probably get me into a lot of trouble. So yes, we are doing some modeling. So I did mention that we're working with OES and doing some modeling and predictions. I can't really say what those results are going to do. So, whenever you do any type of forecasting or predictive modeling, one of the barriers for figuring out those models, and there's a lot of data scientists on the call here that can back me up, is you need a good training set. You need good historical data. So do we have that, right? I don't think we do, because the outcome of whether it's a W versus a V is going to depend on how society is going to handle the next 6 to 12 months, right? The data can show you everything that it wants to show you, but if society goes a different direction, then that prediction is going to be way off. The only other thing that you can look at as a scientist, as a data scientist specifically, is how did previous pandemics pan out, especially previous pandemics with very, very, very similar diseases. So the one that everyone talks about is the Spanish flu that was around 1918. And that was, an initial wave that was quite tragic, but a second wave that was even much more tragic. And unfortunately, we're seeing a lot of similarities between that and what's happening today. So, I can definitely provide my viewpoint. I don't want to do that because I definitely don't want to make this a political discussion. But I can say that in order to come to that conclusion, as a data scientist, I would definitely not just look at what's happening with this pandemic, but look at historical pandemics and then use that information to come to a conclusion. Unfortunately, what we're seeing is that most likely there will be a second wave, but we just don't know how bad it's going to be. It's really going to depend on what society does to react to that. And that's really going to drive it. So that's all I can say about that particular thing. So I hope I answered that question.
Hey, Steve, I can speak to David's next question. So it's surrounding if anyone is estimating the total number of cases based on sampling studies. So yeah, I think that this is kind of being done to different degrees by different agencies, both within California and also on a national basis. If you go to 538's page, they actually have a collection of all of the that's Nate Silver's website. They have a collection of all the various models that are out there and kind of what that range looks like to kind of piggyback on the previous question. I will say for California, within the departments that we're working with, we are tracking both confirmed and suspected was the terminology earlier within hospitals. Now that testing has become more available to pre-symptomatic and asymptomatic folks, there's more modeling being done to get at kind of that true case fatality rate and what the actual positivity rates are throughout the state. So that is sort of being actively improved as more data is becoming available. I think that's probably close to, especially like the positivity rate and some of those other stats are available to some degree publicly. So I would just say keep an eye out to get sort of that truer metric. I think the big limiting factor earlier was the number of tests. That's why some of those extreme numbers were coming in March, but that's a lot better data now for how the state is handling it.
Great, thank you, Brent. I'm gonna mark that one as answered. Okay, we've got one more question left. Please enter your questions. We only got 5 minutes remaining. So Annalise said, is there anything that we can do to help with regards to the analytics on a volunteer basis? That's a really good question. So one of the things I mentioned was, these agencies that we're going to start working with are definitely going to need help and skill sets to essentially work with getting this information updated. I'm not sure if they'll take volunteers. I wouldn't even know where to point you to. But that could be a way to, to sort of see if you can lend a hand. The agencies that I would definitely reach out to are the Department of Public Health, the California Office of Emergency Services. I think those two are the prime agencies that have a lot of this data and need the most help. They definitely have resources like us, but obviously the more the merrier. One of the things that I would say is if you really want to do your part, right? I would say, use your skill set to help inform your friends, your community, build a dashboard, put something out there that you feel that your community is going to trust more than the data that's out there. Maybe, something that's catered to your specific area or your specific domain to sort of spread the word. Because one of the things that I'm worried about with this whole thing is I see that, that people are sort of relaxing a lot of their restrictions. And I think that that's going to cause, what was asked about earlier, that second wave. And that's why I said, no matter how much analytics we do, it's the social response to this that's going to curb that second wave and either prevent it or make it not as bad. So if you want to volunteer and you want to use your analytics skill set, that's one of the things that you can do, is just get the information out there, learn something new about a technology, use the data that's out there, build something for your friends, because I think that will resonate more than a lot of the dashboards they see in the media. Maybe they'll take yours more seriously and you'll help people take this pandemic more seriously. So that could be a good thing that you can do. Brent, do you have any other things you want to add to that?
Yeah, I think that's a really good start. If you go out to, I know there's like a Data is Beautiful subreddit. It's been sort of dominated by COVID-19 dashboards over the last few months. That's kind of a really good spot to just see what other data enthusiasts are doing. Definitely check out Tableau Public for, you can download the free software there, access some of these data sets that we mentioned. Aside from it just being kind of good practice, as you mentioned, and learning a new technology, I think it's just really interesting information to dive into to better understand, some of the numbers that you see coming out in different places.
Yeah, and another thing that you can do if you want to volunteer also is, the hospitals need your help, and they would love to have an analytics person come on board and help them get their data aggregated and sent up the chain. Because don't forget, a lot of the data that we see from the state departments that we work with gets aggregated from the facilities all the way through the counties and up the chain. And that's a very manual effort. I know that some hospitals have some great IT staff. They work with some great partners like us, but the community hospitals, which are going to get hit the worst, they don't have that. They have a nurse sitting there entering data or calling up the Department of Public Health and telling them their case count for the day. So that's a great place to volunteer. Maybe you can help build a solution there that can help automate what they're doing and, alleviate that hospital to focus on what it needs to do.
Yeah,
So
and I mentioned contact tracing earlier. I know a lot of state staff has been a portion, so making those phone calls for folks who test positive, and then also reaching out to their circle of connections to let them know somebody in their network has done that. I believe they're still taking volunteers, so that's another way folks can potentially help.
Okay. I think that was the last question. Any other final questions? We're approaching 7 o'clock. We've got 1 minute left.
Great. I think we are done with the questions. So, Steve, Brent, thank you very much for hosting this webinar and making this, a great one. This is the first time we have done this, at least DataCon LA. So, thank you everyone for joining. Couple of things I just want to quickly mention, since some of you joined late, is DataCon LA is going virtual this year October 23rd to 25th. We'll be sending out registration information in about a week's time. So please see that. Also, if you haven't heard, we launched a non-profit. Actually, we're in the process of getting non-profit status on Data for Good last year. We are going to be looking for volunteers for several projects we are working on. Look out for a notification from me and the team. You'll probably see a lot of information about how you guys can volunteer. We have multiple pods which we're working on. Some of them related to COVID, some of them related to the challenge of Black Lives Matter, homelessness, and we are looking for help in analytics, designers, UI, UX designers, marketing, so on and so forth. And we'll put out a call for that. So in the next week or two, we're going to be looking for a lot of volunteers to help us out with that. If you're interested, you can reach out to me. I'll be sending out a link where you can sign up. But this is a great way. Each of these pods are going to be limited to 2 months, and we're trying to keep each volunteer's time to about 5 hours per week. So if you're able to donate about 2 months of your time, 5 hours of a week, we would love to have you come join as a volunteer. With that, Steve, Brent, thank you again very much, and thanks all for joining. A video of this will be posted in a few days. Thank you. You can subscribe to our YouTube channel, DataCon LA. It will be posted out there. Thank you very much.
Thank you, everybody. Have a
Thank
good
you.
night.